So prescriptions of antidepressants have vaulted in recent years. So for example, in 2010, there were around 40 million prescriptions in that year in England, whereas last year that figure had risen to over 80 million prescriptions. This means that approaching 20% of the adult population in England is prescribed an antidepressant in any given year. In addition to this, we've seen the average duration of time that a person spends on an antidepressant actually double in the last 2 decades. So not only are we prescribing more of these drugs, we're prescribing them for longer. And this may help us account for why we see so many people in psychotherapy taking antidepressants, many of whom are considering whether or not to stop. Well, if you are considering whether to stop an antidepressant, there are some pointers to consider. The first is, if you experience these drugs as helpful and well tolerated, well, the medical advice is generally to consider continue taking them. Now, there are some caveats here, of course, with respect to the dosages and long-term use. After all, we know from research that long-term use is associated with a number of harms that may come to potentially outweigh any benefits. So it's important to have these conversations with your prescriber because everyone's circumstances are different. If, on the other hand, you experience these drugs as unhelpful, or if the adverse effects are outweighing any potential benefits, then of course it's important to raise these issues with your prescriber. After all, we know from research that antidepressants are no more effective than placebo pills for all but those experiencing severe depression. But unlike placebo pills, they generate side effects and adverse effects for between 30 to 70% of patients taking them, depending on the study you consult. And this brings me to my final and perhaps most important point, which is that if you are considering stopping antidepressants, you should not do so abruptly, but you should do so at a pace that is comfortable for you and with the support of a prescriber. And this may sometimes mean undertaking a very slow taper. Again, we know from research that antidepressant withdrawal will affect around 50% of people taking antidepressants, and up to half of those will report that withdrawal as severe and sometimes protracted, which is all the more reason we need to take things carefully and take things slowly when stopping an antidepressant.